understanding hip replacement and its indications. In this segment, we'll explore the reasons why a hip replacement might be necessary and how it can alleviate pain and improve mobility. A hip replacement becomes necessary when arthritis causes damage to the cartilage covering the femur, which is the round portion of the leg bone. As the cartilage deteriorates, the femur may shift into the pelvis, leading to the bones settling on each other. This can cause pain during movement and increased instability in the hip joint. Instability and nerve compression. The progressive wear and tear on the hip joint can lead to instability and compression of the sciatic nerve, which passes through the hip area. As a result, patients may experience pain in the groin, buttocks, and even sharp pain radiating down the leg. Additionally, the altered hip mechanics can disrupt the way we walk, leading to back and knee pain due to the added stress on these areas. Benefits of hip replacement. The primary goal of a hip replacement is to realign the hip joint, restoring its function and alleviating pain caused by instability and sciatic nerve compression. It's no wonder why most patients experience minimal pain after the surgery. Different approaches to hip replacement. When it comes to hip replacement surgeries, there are two approaches, the anterior and the posterior approach. The anterior approach involves an incision made in the front of the leg around the top of the thigh. On the other hand, the posterior approach requires a larger incision down the side of the back of the leg to access the hip. Infrequent use of posterior approach. It's important to note that the posterior approach is infrequently used nowadays. Most surgeons prefer the anterior approach due to the potential advantages such as faster recovery, less muscle disruption, and reduced risk of dislocation. However, in specific cases, the posterior approach may still be recommended by the surgeon, but this is less common.